Hello everyone, this is our presentations about usage of IoT in the field of pharmacy and healthcare. Before we start our presentation, let me introduce our member first. The first member is Badir, and the second member is me, Timotius Jandana, and the third member is Isak, and the fourth member is Naufal.
The Internet of Things connect device and sensor via the Internet, transforming industries by improving efficiency and reducing costs. The term was introduced by Kevin Aston in 1999, highlighting RFID as essential for automated data sharing. Early examples include the 1980 Coca-Cola machine at Carnegie Mellon, which allow remote status checks. With the 2012 adoption of IPv6, IoT expand rapidly, enabling smart cities and advanced applications like real-time traffic and energy management. Today, RFID is also widely used in healthcare for precise tracking, enhancing patient safety and reducing error.
As previously explained, one example of IoT usage in the healthcare sector is for RFID. Here, I have displayed several real-life cases that occurred in Indonesia. The first case discussed a medication error where the wrong drug was administered to a patient. The second case involves expired medication being given to a patient, and the last one concerns a patient's death, which was suspected to be caused by a shortage of medicine in a hospital. And of course, these incidents are certainly harmful and can decrease public trust in healthcare professionals. As we know, RFID is a wireless system consisting of tags and readers, where the reader transmits electromagnetic waves to read data stored on the tag. This technology enables automatic identification and data collection using radio waves. An example of RFID application in hospital is its use on patient wristband and medicine inventory. RFID is embedded in patient wristband to store important medical information that can be quickly accessed by healthcare workers. Hospitals also use RFID labels on medication to monitor stock levels. When the stock runs low, the system automatically places a restocking order. This improves inventory accuracy, reduces drug shortage issues, and then minimizes human error. Furthermore, IoT can also be used to remotely monitor patients. IoT devices like smartwatches and glucose monitors are used to track a patient's condition remotely and send the data to healthcare professionals. Here are examples of such devices. The first image looks like a smartwatch, right? But it's actually a wearable patient monitoring device used to check various patient data remotely. The second image shows a glucose monitor used to check blood glucose level. All of these tools aim to enable better disease management, reduce the number of hospitalizations, and provide immediate notifications when abnormal conditions occur.
The benefits of IoT in pharmacy. The first benefit of IoT in pharmacy is to improve patient safety and medication adherence. IoT devices like smart pills dispensers can remind patients to take their medications on time and even alert caregivers if a dose is missed. A real-world example is Proteus Digital Health, which developed ingestible sensors that confirm when medication is taken. The second is efficient drug inventory management. IoT systems can track medication stock in real time using RFID technology, reducing waste and preventing shortage. For instance, KitCheck helps hospitals automate medication tracking using smart tags. The third is real-time decision support for clinicians. Devices like wearable monitors continuously collect patients' data, allowing clinicians to make quicker and more informed treatment decisions. A notable example is Philips eICU systems, which enables remote ICU monitoring. The fourth and the last is to enhance access to care in remote areas. Through telepharmacy, patients in rural areas can receive consultations and medications monitoring without needing to travel. Countries like India and Canada have implemented telepharmacy successfully to bridge healthcare and gaps. Sites and limitations or drawbacks. However, there are also challenges and drawbacks. The first is highly implementation and maintenance costs. Setting up IoT infrastructures requires substantial investment, something not all facilities can afford. The second is dependence on internet and connectivity. IoT systems really rely on stable internet connections in areas with poor connectivity. These technologies may not work properly. The third is data security and privacy concerns. Medical data is highly sensitive if not secured properly. It can be vulnerable to cyber attacks. For example, the WannaCry ransomware attack in 2017 affected healthcare systems across the UK. The fourth is technical complexity for non-digital users. Some patients, especially the elderly, may find IoT devices difficult to use. This can limit their effectiveness in real-world scenarios. Ethical and legal considerations. Finally, let's discuss the ethical and legal aspects. The first is to ensuring patients' data confidentially. All IoT systems must comply with data protection laws like HIPAA in the US or GDPR in the Europe. Second is to clear consent for data sharing patients. Patients must be fully informed and give consent before their health data is shared or monitored remotely. For example, devices like Dexcom G6 requires users' consent for real-time glucose data sharing. The third is accountability in automated decision making. When IoT systems make or support clinical decisions, there must be clarity on who is responsible if an error occurs, whether it's the developer, the provider, or the healthcare professional. In conclusion, while IoT offers tremendous opportunities to improve pharmaceutical care, it also presents significant technical, ethical, and legal challenges that must be carefully managed.
The conclusion of Internet of Things. Internet of Things connects devices and sensors through the Internet to improve efficiency and automation. Conclusion of RFID in drug inventory and stocking. RFID technology, which helps automate and streamline drug inventory in pharmacies and hospitals. RFID tags medication in real time, reducing human error, medication waste, and stockouts. The benefit we get from using RFID: first, higher inventory accuracy, automated stocking, better supply chain management, and stronger regulatory compliance. Okay, next, move to the recommendation. Implement RFIDs gradually, starting with high cost. And integrate RFID system with existing pharmacy management software to maximize utility. Provide staff training on RFID use and troubleshooting to ensure smooth adoption. Evaluate cost effectiveness regularly to justify ongoing investment and maintenance. Okay, next, move to the summary of remote patient monitoring or RPM for chronic illness. Using IoT to device like glucose monitor and smart blood pressure cuffs, RPM or remote patient monitoring allows continuous health tracking for patients with chronic condition. Okay, the benefits we get is improved disease management, fewer hospital readmissions, early detection of issue, and more engaged independent patient. Okay, the recommendation is prioritize high-risk patients, example like diabetes, hyperintensive, for RPM implementation. Ensure device user compatibility to avoid usability issues, especially for elderly patients. The conclusion is combining RFID and remote patient monitoring or RPM can significantly enhance both of operational and clinical aspects of pharmacy practice. For long-term success, focus on interoperability training, and data governance to ensure these technologies are secure, effective, and sustainable. RFID and RPM offer significant improvement in pharmacy, operational, and patient care. To maximize their impact, focus on system integration, user training, and data security.
That's all our presentation about the usage of IoT in the field of pharmacy and healthcare. Thank you for watching and stay healthy.